Hi, everyone. My name is Katie Brumfield, and I'm the manager of career services at the Colorado School of Public Health. And today I am talking with Amy Blum. Amy graduated from our school in 2021 with um, MPH, right? Master's in Public Health in Public Health Nutrition from our CSU campus. Hi, Amy.
Hi, thanks for having me.
Yeah, thanks for joining us. Can you tell us where you currently work and what your job title is?
Yeah, so I'm a registered dietitian, and then I'm with CMAR Community Health Centers. We're all over Western Washington, but I'm in the Bellingham Clinic,
Oh, very
so Bellingham, Washington.
nice. So I know we get a lot of people that are interested in nutrition that come into public health. So I definitely want to learn more on how you use your public health degree in your current role. But could you just start off by telling us kind of what does a typical day look like, or maybe like big projects you work on? Basically, what do you do on a daily basis?
Yeah. So it can look a little bit different day to day. So I'm mostly seeing patients. So I do medical nutrition therapy, counseling, outpatient counseling. So we're an outpatient clinic with medical, dental, behavioral health, and nutrition and preventative health. So I am doing counseling. I see anywhere from range of 4 to up to 9 patients a day, but then also working on different programs in the community. We work with Spanish speaking populations, and particularly farm workers. It's very agricultural up here, so a fair bit of my appointments I do in Spanish, and then we do some programs in the community, for farm workers, Spanish speakers, a lot of low income population as well.
Wow, that's really cool. So that brings in a lot of your public health training.
Mhm.
What like classes or maybe internship or anything like that at the Colorado School of Public Health have really helped you in your current role?
Yeah, I was thinking back on that, and I really liked a lot of my classes, and I appreciated how like a lot of them were smaller classes, and they had hands-on project aspects.
Yeah.
But I would have to say that my graduate research assistantships were probably the most impactful because I was able to take what I
Yeah.
learned in my classes and apply it. So developing some programs, like working on systematic review with a professor, social marketing campaign, doing some work with farm worker health and safety. So I feel like I just got a lot of um, graduate research assistantship and
Yeah.
um, in the field experience during my master's, which was great.
Yeah, yeah. Our CSU campus is great for that too. There's lots of good opportunities.
Mhm.
So far in your career, what has been the thing that you're most proud of that you've been able to achieve?
Yeah, that's a really great question. I think it's just cool to look back over the past year. Like I started a year and a few months ago, and just realize like how much I've grown. I had a patient who I'd seen like a year ago yesterday, and like seeing my chart note, and now seeing seeing where I'm at. It's like, whoa, that's I've grown a lot since then.
Yeah, that's super cool.
Uh, and just like being able to see a lot more patients, communicate a little bit better in Spanish, and just know how to do that better, and just seeing the programs we've done too as well.
That's awesome. That's really awesome. Okay, on the flip side of that, what have been some challenges in your career?
Yeah, I would say in this role, like in community health, and we work with patients like mostly Medicare, Medicaid, uninsured, and then some private insurance. But there are a lot of those like social determinants of health that affect people and kind of our priorities. So it can be hard to make changes or just manage diabetes, for example. I see a lot of diabetes patients when food access or mental health a lot of the times can be big barriers for people. So, but thankfully, we actually have ways to kind of address those resources in small ways with different programs that we're doing. Like we're doing a produce prescription program or piloting, so that's pretty cool.
Oh, that is cool.
Um, but another challenge is I think is just the unpredictability. It's great, but and that makes it exciting. Like you get you know a lot of unique people I get to talk with, but then I'm kind of covering all the different areas of nutrition counseling. So it's a lot of to be on top of knowledge wise.
Yeah, yeah. How do you stay organized with all of that?
Yeah, it's been a year-long process, and I'm like always figuring out, refining my system because it's can be challenging.
Yeah, yeah, for sure. Um, so we get quite a few students that are interested in going in the nutrition or dietitian kind of career path. What advice do you have for those students or prospective students? And what do you wish you would have known before going
Yeah,
this route?
yeah, I think, one thing that can be helpful to think about is like, you know, what you're passionate about and what you're interested in on one hand, but also like the type of job environment you do well in.
Mm.
Because one thing I realized, when I did this job is it is so much talking with people and counseling, and actually a lot of those like people skills and, navigating conversations, motivational interviewing. That's a huge part of my job. And so then I realized, yeah, actually, I do enjoy that more than I anticipated. But at first, I was like, "Ooh, it's a lot of
Yeah.
people time. I don't know if I can handle this." But yeah. But so just thinking about kind of what type of work environment it is, what energizes you, what drains you. Yeah, those are things I didn't really think about until I kind of was in my career.
Yeah, and sometimes it's hard to know until you do it on what energizes you and what drains you, you know?
Mhm.
But yeah, that's really good advice. And so you went the registered dietitian track where you do it's a internship, right? A dietetics internship.
Correct.
Did you do
Yeah.
that after your public health degree?
Yeah, I kind of did it in conjunction, but
Oh,
I
okay.
was doing so some are coordinated programs where you do a master's and you do an internship at the same time.
Okay.
Colorado State University does have that program, but it's through the Master's of Science, and I wanted a Master's of Public Health, and
Yeah.
there are other schools that do that, but I actually did my own separate internship, a distance internship, but it allowed me to
Oh,
do a
okay.
lot of my rotations like in Fort Collins and overlapping with what I was already doing in grad
Nice.
schools.
Yeah.
A little more work at the front end, but for me, it ended up working just really well because I got to choose the sites, that I
Yeah.
wanted to in the focus areas I wanted to.
That's awesome because I know that those internships can be really competitive and tough to get.
Yeah, they can be. But there's just a lot of options out there.
Yeah.
And for someone who's willing to put in a little more work, the distance option does make it a little easier. And
Yeah, that's great. I
Mhm.
haven't heard of that. Yeah, I think that's really cool.
Yeah.
And I guess, what brought you to public health? Why did you decide to get your master's in public health?
Yeah. I'd always known, yeah, it's kind of interested in health. More just I loved making food and just the way that food brings people together. It's like community, culture, all sorts of things. Growing up, and I was at first like, well, on the medical route a little bit. And it's like, oh,
Yeah.
this is not the right fit. So, but I'd always then I kind of realized about the field of health, the field of public health, and the prevention side of things. And it's like, oh, this is what I've been interested in all along, and I didn't know there was a career field related to this area. So yeah, so since then I've kind of been interested in public health, and just exploring lots of different areas, from like sustainable food systems to nutrition. But yeah, this is what I'm doing right now.
So cool. Yeah. That's a very common, path to public health. Someone might be going the medical route and then realize that's not for them and find out about public health. And I think that's great. Um, I had a question now. Oh, you love cooking. What's your favorite thing to make?
Yeah, probably at this point, just a big pot of curry. So
Nice,
whether it's Indian or Thai, I love spicy food. Yeah,
nice.
it's great for a crowd. I love like having friends over for dinner. So, and then you can just be kind of throw things together what you have on hand. So
Yeah, yeah,
yeah,
that's
definitely
awesome.
my favorite. Mhm.
Good, 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 good. All right. Well, is there anything else that you would like to share about your career path or tips or advice for those watching?
Yeah, I don't think I have anything else other than I think just be open and try different things during your masters because it's such a good opportunity to learn about yourself and you know where I'm at I didn't actually really want to be a clinical dietitian but just exploring things and here I am and yeah just be open to trying new things you might not know what is best for you.
Yeah. Yeah. I hear that a lot with our alums. I didn't know I was going to be doing this, and I am, and I love it.
Hmm.
Yeah. Great. Well, thank you so much, Amy. And thanks for watching. Bye.